As an occupational therapist, how would you say that has contributed to your expertise in treating individuals with pelvic health dysfunction?
They're walking into my office with pain. And yes, I am looking at their muscles, their structure, and physiological changes too. But I am also looking at their mental health, their nervous system. Being a therapist that has worked in neurological conditions for up to 12 years, I bring all of that knowledge base with me into my practice. So, and I apply it because what are we seeing highly of, right? If anyone is living in pain, they are probably more prone to anxiety, more prone to depression, more prone to isolation, more prone to fear, right? Because we'll see it in the patients that are like, they're scared to move, they're scared to try different things, they're scared to trust a practitioner. So I use all of the cognitive behavioral therapy techniques to help them learn more how to process through all of that, right? You can't separate the body from the mind at any point. So I bring it all together, and being an OT, that's all we focus on, right? Is those roles and rituals and habits, and what does that mean for the person? Not just what it is, but how does that make them up? I had my own pelvic floor issue.
Hmm.
I would say 5 years ago. And it was probably 10-year slow but surely until it erupted into something like really crazy. And at first it kind of started probably after my son. So my son's about 14. I didn't know anything about pelvic floor. I didn't know what was going on. I just kept doing, I worked a lot. I was a regular OT on a stroke unit. Um, I was also a director of rehab. It was busy for me. So I didn't think that there was anything to be done. I just thought I had to make do with this and kind of live with it. One day when I was doing home care visits, I felt like my backside was on fire. So like from the glutes all the way to my heels, plus everything in between. I went to the emergency room. They ended up admitting me for 4 days. They ran every test that they could run under the sun, and everything kept coming back like, there's nothing wrong with you. There's nothing wrong with you. Because the doctors were saying that there was nothing wrong with me, my husband was so like confused. Like, are you having, because every time the doctor would say the test was normal, then he would say, well, maybe this is in your head. Maybe you should speak with a therapist. So then my husband's thinking, like, are you losing your mind? Like, are you imagining all these things? Meanwhile, I'm in the hospital bed with like all this pain. So I felt like I was literally losing my mind because everything was saying that I was crazy. So I went through such a depression for a full year, to the point that I actually wrote my own will because I didn't understand what was happening. And oh my God, I was thinking the worst. And I just wasn't clear. I mean, I was so depressed, like so depressed because no one was listening to me. I was still living in pain. I had every fear you could imagine because I thought maybe I wouldn't be able to work. And then what's going to happen with my kids? And oh, it was, the mind just completely went. In the middle of that, I got a patient she was about 72, recently diagnosed with dementia, and they were trying to put her in the nursing home because of her incontinence issues. And I didn't think that she should be there at all because she was ambulatory, she was with it, had slight forgetfulness, but nothing that she couldn't, at least live at home for a couple of more years. So I went online because I am that therapist. I will always look for something to give my patients and help them. I found Tiffany's course in biofeedback. So I took the course. I was so excited. And I'm like, yeah, I'm going to do this. They ended up admitting her while I was in this course. So that didn't go through. And then I was so intrigued with pelvic floor that I just kept trying to take these, but still in the mind thinking that I'm doing it for all the clients and I have to live with this. I will never forget. I took Laura Ronan's class, right? And when I was being examined, I felt where the injury was. So I asked the student, can you palpate here? Like, do you see, like, do you notice any changes? Because I feel something. Laura came over, she kind of verified it. So then once I knew that it was actually a levator Annie issue, I went in and I started doing therapy on myself because at that point I took Herman and Wallace 1. I did Laura's class. I was already in 2. About 6 months kind of doing my own therapy. It was gone.
What
It was gone.
exactly did you do?
Oh man, so it was a lot. So I did biofeedback first, right? Because I had to see like, okay, so when is my most overactivity time? That was pretty much my solid base. I was just learning like the manual skills. Once I took Laura's class, I started using the self-release dilators to really work the levator Annie. I took my ortho skills and I started really working on lengthening that muscle with hip exercises, range of motion techniques, and then went into light strengthening. I knew I had to work on digestion issues because constipation probably drove that from before because I was chronic with it. So I fixed my diet. I increased my water. I was a famous belly clencher. I mean, I did it all the time. And I really worked on like fixing my nervous system. And that's where I went into like somatics and cognitive behavioral therapy because for me, yes, it was clenching, but it was also tied into overstimulated nervous system, no idea how to regulate it. That was my compensatory strategy. Really started changing my perspective on a lot of things because I was that like type A, everything has to be perfect, rigid thought process. Combined everything together, I can honestly say it's been like almost 5 years now, and I have not felt that. So, a couple of patients that just recently gave birth, they don't want to wait till the 6th week to see me. But this is such a new realm for me.
Mm-hmm.
I don't know, I don't know what my role would be there.
Okay, let's talk about it. No, let's really, really talk
Right.
about it. They gave birth or they're about to, like
So I had
they're
a
pregnant.
patient that just gave birth this morning.
Okay.
So before, she kind of knew that because they were going to do the membrane sweep for her 2 days. No, yes, the day before yesterday.
Mm-hmm.
So she was like, do I really have to wait for the 6 weeks to see you? And I'm like, as far as I know, that's just how things have always been.
Mm-hmm.
I was like, but I am going to reach out and speak with an expert in doing it sooner. I was like, but for now, we're just going to keep it at the 6 week
Mm-hmm.
until I can get a ground idea on like, what does this look like?
If I can't convince you to see her this week, then you do not need to take my course. Okay, so in the next 13 minutes, we're going to actually talk through, we're going to talk through this. And this is all seriousness because honestly, I think to me, the medical model almost convinced me that I didn't go through all the training that I did to learn what I knew, right? So you have this mom who is at this point, like first time mom, second time mom, third, like, is this
She's a
first,
second time mom. This is the
second time
second one.
mom? So
But
then how
she's
old is
had
her
a
baby?
harder pregnancy this time around.
She had a
So,
harder pregnancy.
yes. So
Okay.
I've been working with her. She came to me for the pubic bone pain.
Mhm.
We got rid of that. She had deep hip and low back pain. We
Mhm.
definitely lessened it, but um her something was going on in her abdomen that I can feel. I started studying visceral
Mhm.
manipulation. Turns out that she was actually overproducing amniotic fluid.
Mm.
I kind of felt like there was some kind of a pressure
Mhm.
that me and her just couldn't keep up with. And it was changing pretty rapid.
Mhm.
Um, so come to find out, when they did the membrane sweep, they
Mhm.
ran some tests and then they called her this morning that she was going to come in. They were going to have her to be induced because she had way too many amniotic fluid
Mhm.
in her belly and they
Okay.
wanted to just rush the labor. So she got freaked out and was like, I don't know how this is going to happen. She was like, but I want to be able to see you like as far. I don't think I can wait 6 weeks.
Right.
And I was like, okay. I was like, I'm going to have a meeting with Rebecca. I was like,
Mhm.
because I don't know what that looks like. Like, I don't even know as a clinician, like, what is my boundaries?
I'll
Like,
I'll I'll tell you right now. Okay.
okay.
So with a pelvic health client, perinatal pregnancy, I
Mhm.
don't want you to think of the eval as being what you would typically do with these individuals 6 weeks, at 8 weeks, at 12 weeks, and so on. At
Okay.
this point, they're dealing with physiologically a lot of fluid now returning to their body from the uterus reducing in size over the next few weeks, from even
Mhm.
just the labor and delivery itself. We already know that from a physiological standpoint, their cardiac output increased over 90% over the
Yeah.
course of their whole pregnancy. And so all of the stress on their heart doesn't happen right away. It's almost like I'm going to give you some terms that make pregnancy and postpartum seem like that is this scary thing from a practitioner standpoint, but it's really not. When you understand the physiology of just what a normal person goes through, everything makes more sense as to why you would want to see them first week if you can at home, or even a virtual visit like this.
Got it.
And so I like to think of the heart as almost like it's this machine we know is working all the time, but sometimes we don't see the delay of the effects of labor and delivery, maybe 3 or 4 days down the line. And this is why. So the heart has to keep blood getting to the brain, right? It has
Mhm.
to, like, you just to remain conscious, all of that. However, when it comes to functioning of other organs, a lot of that slows down. It's almost like that's not as important as me getting blood to the brain.
Mm.
So I could have moms who are talking to me who just look fine. Everything's great, Nicole. Hemoglobin is steadily dropping. Why is that? They're not losing any more blood, except they are. After a
Wow.
vaginal delivery and cesarean section, it finds out too. I mean, cesarean section, you just had a baby through the abdomen, but your uterus still is shrinking over time, right? So even though you
Mm.
didn't have that baby vaginally, you're still going to be losing blood. And we have to tell moms that your lochia or your period blood, it should be less than a period, is going to happen over the next few days. But for moms who are more active, especially moms who have either a little one at home or other responsibilities, maybe a pet, maybe they are, responsible more for getting the baby either the bottle ready, storing their milk, doing things around the kitchen, throwing stuff in the washing machine, cleaning. They want to take a shower, a nice hot one for the first time. All of that energy, right, will actually cause the uterus to contract a little bit faster and harder. So they
Wow.
actually will lose more blood than someone who, say, in our higher socioeconomic, classes, who have a lot of support at home, who are able to rest a lot longer. Their blood loss is a lot less over a longer period of time. Does that make sense?
Yes.
So a lot of our moms, in the United States lose a lot more blood in a shorter amount of time, our hemoglobin drops, and we could be talking and looking fine because heart is getting blood to the brain. That's all it cares about, even though our other organs are compromised. So
Wow.
preeclampsia is not an event, it is a journey almost. It's almost like that's the destination of where you're diagnosed with preeclampsia within the first 6 weeks, still postpartum. It's because
Wow.
all of these little things happen over this course of time.
So
So
time.
it's almost like, to me, if there is one, and I'm not saying this because you're an occupational therapist, I live and breathe everything I'm about to say to you. If there's one provider I want in the home, is an occupational therapist, because you see that occupations, there is not one or two or three or four, there's an exponential amount of occupations that that person is taking on.
Yep.
Right. And if one or two or three or four could be modified, then that's less stress on their kidneys, on their liver, on their lungs, on all the organs that are not as priority as the brain is.
Gotcha.
Eventually, even the brain becomes compromised. And that's where we get into the mental health aspects that we're trying to treat now with medication. I think you knew there's an FDA approved drug that was just
I
passed.
saw that.
Don't get me
I
started.
was
I like,
so pissed off.
do not
I
get me
was like,
started.
are you kidding me?
No, and they're not. They're not. They're not, because instead of actually working upstream to say, okay, well, what will then eventually cause psychosis that could lead a mom to do that, right? We have a pill for it. That
That's
that's
in-
that's insane. And so I'm thinking like, okay, I in my courses actually need to focus on physiology, because once you hear this, then it's like, I know exactly what to do. I'm going to take her vital signs. You won't know her hemoglobin, and that's okay. But you
yeah.
can start asking her, so what have you been doing? How much sleep have you been getting? What's been a comfortable position for you to breastfeed? Even if you don't know all that yet, you just being there and helping
Yeah.
her problem solve some of these things can make and really reduce a lot of, like, maybe even anxiety or maybe uncertainty or maybe anything that she's feeling, and answer her questions and just be there. Right.
Right.
And something like this, even if you can't do a home visit for every mom, my goal is to have a practitioner like you in every state that can at least even talk to moms about, who is your support system. We're going to need to call them right now. We're going to need
Yeah.
someone to do those chores around the house or do the laundry around the house. And all you're doing is you are acting as a point of care person to basically say, I'm going to need you to get your almost your welcome party. Anyone who's coming over to see baby has a job.
Gotcha.
They're bringing food, they're cleaning, they're caring for baby, and you are sleeping,
Hmm.
right? Only a provider can make that kind of prescription. Someone who trusts you enough for their medical and their health care will listen to that kind of advice. Doulas can only go so far, but they're not taking the blood pressure.
Yeah, they're not doing
They're
vitals.
not monitoring, but they can maybe do a little bit around the home, but in terms of like having someone bring their support system and strengthen that kind of like timely care around the first 2 or 3 weeks at least, they
Okay.
don't, that's not really their role.
Gotcha. Wow, that's amazing that I didn't realize that they don't check vitals.
Doulas don't check vitals. If they're doing it, they're is doing it outside their scope. And you have to realize, so doulas by history, I mean, they're trying to change that with, I think, even like some of these certifications, but they're not licensed providers. Like there's no kind of like board that's overseeing doula training. Medicaid, TRICARE, and there's other insurances, Nicole, I think, that have just like five are now reimbursing for doula support, but really
Oh,
it's support. It's not intervention.
intervention. Got it. See, I'm still learning, so
Mm-hmm.
I'm not too familiar with like what exactly is the role of a doula? Like
Mm-hmm.
what can they do? I'm slowly but surely learning that as I start like networking. But I wasn't exactly aware of that.
Mm-hmm. They're
Okay.
supposed to be advocates. So if the mom is saying, I'm feeling this, something's not right, they're supposed to tell mom and family, go to your doctor, ask your doctor, go to your midwife, ask your midwife, all this. But they don't actually get on the phone and make that call like we would. And so if
Okay.
mom is just like overwhelmed, tired, forgets, then what the doula saw is never documented anywhere.
Gotcha.
Right.
Okay.
And so that's why I say, I do think that we will probably be more of the point of care providers in the community for this population. And then my goal, I mean, everything that I'm doing with my course is to be the on the care team, at least as a like a standard uh, during high risk pregnancy and immediately after birth, because nurses right now are not taking vital signs with activity. And we know if you're up at the sink brushing your teeth, or if you're sitting down and taking your shower for the first time after birth, that's not really going to mimic all the other things that you're going to do at home. So how are you
Right.
really responding to that kind of activity? And if we don't have an assessment, then we're really sending you home to figure it out for yourself.
Agreed.
Right. And so the whole goal with the course is to get this started in the hospital. But then guess what? I'm leaving a huge gaping hole between the hospital and between 6 weeks when they're going to see someone.
So that is my idea because obviously like I'm an independent. So
Mhm.
chances are most hospitals would never contract me and even for that
Mhm.
because more than likely they would just put it into practice, in their hospital and not have to contract me.
Mhm.
Um, but once they get discharged from the hospital, that's where I want to kind of make it fit.
Exactly. Either you, because one, I'm guessing with two locations, you're only going to grow your team. So either you or an extension of you, but you, I'm talking about you, your business, not
Yeah.
you, Nicole, the therapist, but you, your business will have this extension service that catches those individuals between 0 to 6 weeks. And
Yes.
so my goal is that if you can do this with a population that's young, relatively healthy. I mean, we have to give it
Mhm.
to the maternal health population. We are young, we are robust, we are resilient. There is kind of these that we have the highest maternal mortality rate, but I think for the most part, if we could actually normalize it with this population, we'll normalize it after hysterectomy. We'll
Right.
normalize home visits after prolapse repair, right? Because women are still thinking, well, I can unload the dishwasher. Well, you just had a prolapse repair. Like, actually, no, that's a lot of bending and flexing. And that's not even
Oh, I
putting in pressure,
know.
even if they're
I
not
had
working.
two hernia repairs. Um, I think the first one had a big to do with why I even went into like so much pelvic floor issues.
Wait a second, you had a hernia repair before you figured out your levator ani issue.
Right. So when I was pregnant with my daughter, I got an umbilical hernia. The restrictions, it's like can't lift anything for 6 weeks. I couldn't do that. So I tried to push it off and ignore the surgery as long as I could because at that time my husband was not home to help me.
Mhm.
And I knew that I would have to keep lifting the baby. And, we lived in a walk up. So that's 24 steps down to get outside,
Mhm.
so that stroller, car seat, there's no way. And I worked in the hospital in a bariatric kind of unit as well. So that's 300 plus people
Mhm.
that you're lifting. So there was no way that I can like fit it in. So I tried to push it off. I went about 6 years and because I didn't really know I was a stomach clencher. I used to hold my stomach all the time. I wasn't breathing properly. I'm sure that contributed to the original hernia abscessing.
Mhm.
So when they went in to do the mesh, they did it the old traditional way, not laparoscopic. Heal time for me was rough. I would say they told me 6 weeks.
Was it
I
an
took
open
about
hernia repair?
12. Yeah, they did the mesh and everything. So, but I didn't know any better. Like when we were going through this, like I just thought that that was my only option. Like I have to do this repair. I was told it would be like 6 weeks. It actually went 12-week recovery. I was never the same after that, like completely never. the same. I went from having no back pain to consistently having right-sided back pain all the time. COVID hit. I still, I mean, I can honestly say that, like, I know it's there. I feel it. Like, COVID had hit because my fascia is already compromised. I ended up getting an inguinal hernia as well. So later on, I'm still dealing with that right side because on the right side.
So on the right side.
I'm I call myself the bionic.
Right.
I have all the mesh on the right.
Right. That's
So,
um
and again, like going home after those surgeries, I had asked if I should go have therapy after, for recovery. And I was told no,
so
that
this
it was fine, it was not needed.
is direct access on the horizon, first of all, for OTs.
It is. So guess what? We just got it in New York.
Not in New Jersey though. So it's
Right.
state by state, state by state.
Day by
It's state by state. So New York, you have direct access. I can see you in New York and say,
Yeah.
I need pelvic health therapy. Okay, my OB said no, but I know I need it and I'm going to go and call and you can
Yes, we
schedule
have
me.
direct access now, but only
I'm
10
done.
visits,
Okay. Let me
which
ask
is
you, how
something.
long after your birth was your hernia?
It was immediate. I had it during the pregnancy. My belly button was completely pushed out.
Here's what I
Um,
want you to do on this home visit. Okay. So if you do a home visit with her in the next week or two, but not
mhm,
after 3 weeks, after 4 weeks, after 5 weeks, like hopefully in the next week or two,
okay.
just assess like, is there any pain that she's experiencing post birth and look at how she's moving, getting in and out of bed, getting in and out of the chair. She may not want to lie down if she's like up with baby, how she holding baby, all of that. Because say
Mhm.
she didn't have one during pregnancy, anything and everything that she could potentially be doing that's putting
Yeah.
pressure through her pelvic floor or her fascia, right? Her
Yeah.
muscles have been stretched. And if she was in pain during pregnancy, that means she wasn't really active, like to the
Mhm.
degree we would want, that a lot of us on the fit side and saying, stop catastrophizing birth. Well, for those of us who don't want to catastrophize birth and we want moms to be really active and fit,
Yeah.
was she even in that category? And if she wasn't, then we have to realize that anything she's going to be doing during this recovery period is going to stress those tissues even more.
Okay.
So even though you're not doing a pelvic floor exam, you are assessing her vital signs. You're looking at how she's either clenching or doing a Valsalva maneuver just to move and just to do simple things. And then
Hmm.
you're just coaching her on breathing, coaching her on anything that one reduces the amount that her body has to work for just the simple tasks of every day. So if you just focused on sleep quality, the positioning that she's with her baby, and just her day to day, like her overall mental state, that's enough for one visit. Even if you never got to an abdominal binder, if that's even appropriate right now, just depending on like what she needs, so that one, we're
Hmm.
not teaching her to compensate, but then two, if she really truly is feeling pressure, we're supporting her while her muscles are
Yes.
still healing. So an abdominal binder to me is a no-brainer when it comes to C-section, but vaginal delivery is very much, this needs to be a practitioner that's assessing
Hmm.
this versus being a course telling you just give everyone an abdominal binder, because that might not be appropriate, right? And
So true.
then at this point, she could start doing isometrics. We would do that after
Yes.
a knee replace. So she can learn any isometrics. And if you feel comfortable, if she feels comfortable in the second or third week, if she's like her bleeding has come down, then you can
Mhm.
see from an external if she's actually activating appropriately her pelvic floor or
Okay.
even her abdominal muscles with breath. Now, Nicole, did I convince you to see her?
Yes, you did. Yes, you did.
Yes.
You're
And then
great.
also, you'll be able to train other people. You're already doing it with your student. And
Yeah.
so the more of you that's just kind of duplicated, that's all I care about, is that if you can convince yourself after you've seen this mom and you are just like almost getting her permission to document her journey as well, that
Yeah.
informs your practice and informs other people around you. And that's all I want. Pelvic Health Network is really just trying to make pelvic health education accessible to everyone. right? And so no
Yes.
mom has to wait if she already has identified 6 weeks is way too long.
Exactly.
Yeah.
I always felt that. I just felt
Mhm.
stuck because I was like,
What do I do?
what does it look like?
Yeah.
You know, because I'm used to like 6 weeks we do internal, but I wouldn't feel comfortable doing internal, you know, before that. And then what, you know, but now that you actually like piece that together,
Mhm.
I feel so much better.